Hello and welcome. My name is Oli Barrett, and I'm joined today by the founder of OKKO Health, Dr. Stephanie Campbell. Stephanie, welcome.
Hi, Oli. Thank you so much for chatting to me today.
You're a founder, but you have actually quite an unusual background, which is very, very clinical. So just remind us about how you got started on your journey.
That's right. So by background, I'm an optometrist. I've been seeing patients for 10 years. My PhD is in detection of eye disease in vision science. And so I come, with a clinical and a research background, and now into tech founder.
And I know for all entrepreneurs, they're either spotting an opportunity and quite often, let's be honest, spotting a problem, something which is a little bit broken, could be done better. I wonder how it was for you. Take us back to the genesis of OKKO.
Yes, absolutely. That's totally where it came from, a problem that was really staring me in the face for a long time. What I realised in my clinic was that of all the patients who had arrived, say it was 10 or 15 in the morning, about half of them, had we had the right information beforehand, just didn't need to be there at all. Whereas the other half, really, they had almost come too late. And I guess part of it was me wanting to do a really high quality job for my patients, having a really good, meaningful consultation, but then also having so many people to see. So for me, it was clear that tech could do that.
When I started looking into OKKO, I think I expected something a bit more traditional, an eye chart on my phone. It isn't that at all. Tell us what you've created.
Yeah, so it doesn't look at all like an eye chart. The eye chart is beautiful and it's traditional, but it's probably not the best way to measure vision. And for many, many years, vision scientists have been using other symbols to measure vision that are maybe produce more consistent results than an eye chart. And so we use those type of symbols. And in the same as an eye chart, some are easier to see, some are harder to see. We do those in quite a clever way that it just looks like a video game.
I have used the app for test purposes before we spoke, and it did remind me of a computer game. I found it strangely rewarding with a series of sounds and noises.
Yeah, it's really good fun. And that's the thing, the science doesn't have to be boring. But implementing that vision science with the games technology and with the data science as well, it can be really good fun.
One thing I've noticed about eye tests is, yes, I might have a guess that is a Z eventually, but it could take me quite a lot of time. And I just wonder whether an app could detect that sort of other dimension, I suppose. I'm just trying to wonder, how it differs from the in-person experience. And I know that's what some people will be wondering.
For me, that in-person experience is really important. And I can tell by the way that somebody reads an eye chart how well their vision is doing. It's not about what line do they end up on, but it's about how do they get there. And the beauty of this technology is that we're able to capture those different dimensions. How easily does somebody read? How long does it take them? There's a whole pile of other dimensions as well that we are the only ones really to put into our technology.
Unbelievable, really, really exciting. And clearly this has significant global potential. Am I right in thinking this is quite a hot area right now? I'm reading quite a few reports around how, for example, DeepMind are using their artificial intelligence technology to support eye health. Just give us your sense of the bigger picture.
Yeah, absolutely. Ophthalmology is really hot right now. I guess first of all, because it's a massive market. So ophthalmology is the busiest outpatient department in a hospital. That happened last year. It overtook the other departments. And because of that, there's a lot of people coming through. So what we need is technologies that help to automate those processes.
You are, I understand, working with leading eye hospitals globally. Presumably, though, they do get a number of approaches from people around digital health and health technology. So, to put it bluntly, what is it about OKKO that has made you get that one step ahead and helps them realize that this is a bit different?
Yeah, a little startup from Bristol. We are really excited about that. And I guess what our secret sauce is, a few different things, but predominantly our approach to this. We've got a really deep-seated knowledge. We know how to get great vision science into something that's really usable. but also that co-design approach. We don't put anything out there without it having been co-designed with our patients in mind right from the start. We're constantly reaching out to professionals to make sure that their influence is really, really heavy. That dialogue and our openness as well to co-design, I feel, is our secret sauce. I feel we're very easy to work with.
How does this get into the hands of a patient? Is it directly to the consumer? Is it through their doctor? Give us a sense.
So right now we're launching the apps to professionals, and the professionals prescribe them to the patients that they want to look after between their regular appointments.
At this current point, just give us a sense of the business model. Who's paying for this? How does this become a successful business as well as something that makes a big difference?
So at the moment, this is a software as a service model. We're looking at monthly and annual subscriptions for patients who are being prescribed this technology. We're looking at healthcare systems paying for that, so just as they would do an ordinary prescription. In fact, we're seeing a move really to digital prescriptions, so it looks like we're going to be able to drive that for ophthalmology.
As a company, just quickly recap the journey you've been on so far.
Wow. Well, yeah, we've done a lot in 2 years. We've moved this from something that was a project, an idea, into something which is a business. We have been part of Set Squared Accelerator in Bristol for 2 years now at least, and that's been incredible as a framework for setting up business. And the other 2 accelerators were more specific. So the KQ labs, we were part of their original cohorts last year, and that was part of the Francis Crick Institute in London. So that gave us a real focus on digital health. And then later on last year, we actually got onto Bayer's G4A accelerator at the Bayer headquarters in Berlin. We were the only UK company on their accelerator, and they picked 7 companies from across the world. And it was great to be in a European centre, but also with that real worldwide influence on learning where digital health was going and what our place would be.
And give us a sense of that funding journey. Self-funded it, brought others in. Tell us how you've done it.
We've been fortunate to be able to use a range of funding types to get where we are. So we self-funded for quite a while. And then with our accelerators, both of our health tech accelerators, we got convertible loans from. So that was a real kickstart for us. And that we leveraged that to bring in angel investment as well. We've raised 500k to date, and we're raising again.
There is still an opportunity for potential backers to have those conversations.
There is, yes. With the right people, we're always ready to have the right conversations.
I wanted to ask you about the pandemic. For some startups, it means they've been frozen. For others, they've thrived. Give us a sense of how it's impacted OKKO Health.
Yes, we did the same thing that loads of startups were doing in February, seeing what was coming, adjusting our finances, really, really cutting down to make sure that our runway was going to be as long as possible. Yeah, we didn't expect then a month later to be getting phone calls from hospitals to say, is your product ready? Can we use it? This will really help us during COVID to keep in touch with the patients who we just can't see in person. You know, we need this. We need to be able to measure vision to deliver proper tele-health, tele-ophthalmology care. It's not enough for us to see somebody on a video. We actually need to know how their eyes are performing if they're responding to treatment. As
of this year, 2020, give us a sense of where OKKO can connect in a global sense.
Yeah, so right now we are currently today focused on figuring out the partnerships with the leading eye units, not just in the UK, but all over. And I think in terms of spreading this, we're just making sure that our technology is as scalable as possible. And ultimately, I want to make sure this technology is available to the clinicians who really want to use it to enhance their care.
If we wind the clock forward a few years, give us your destination in mind for OKKO.
Yes, so right now we are monitoring. We'll move towards, as we go later into 2020 and into 2021, and as we move up in terms of the medical device classifications, and we have built that evidence base, we'll move a lot more into diagnostics. So hopefully in the future, this is the kind of thing that will just run in the background of people's devices, and hopefully our technology will be, you know, the first ones to say, hey, I think there might be a problem, before even the individual themselves knows that there's a problem. There's so much else in the pipeline, and I tend to get really excited about stuff, and I want to get it all in the product releases. And I'm just told, no, we have to concentrate, we have to focus and just get one or two things really, really right.
I've been struck by the diversity of your team in terms of sheer range of skill sets. Are you hiring, and who in particular are you looking for?
Yes, so we're looking for, you know, techies who really are inspired by health. I mean, now is the perfect excuse to get into health and make a meaningful impact on it. You know, we want people who are great to work with and people who are excited to learn about the optics and the medical side of things.
One of my favorite questions, who do you most want to meet to help your full ambition come to reality for OKKO?
So somebody I would love to meet again, somebody who I met very briefly a couple of years ago, it was Dr. Claire Noverall, one of the founders of OKKO Health. I'm just really drawn in by that passion to take specialist knowledge and make it mainstream. They've had a really grown-up approach about what they've done and how they've done it.
Steph, you have a bit of a hit list. It is about attracting tech talent. You are looking for kindred spirits. You are in the market for further funding. Anyone else in the mix that you're thinking right now, we are calling out because we need to have those business conversations with this type of organization?
I guess the only other group is medical device companies and drugs companies that want more data on the products that they have, you know, that they want not just to be able to demonstrate that people can read better on an eye chart after they use their products, but actually how they live better, how they see better. We really want to speak to people who want to capture the richness of our vision.
Steph, this is a really important launch moment for OKKO. Tell us what you're most hoping that this will trigger for you and, of course, for the people with whom you connect through the company.
Yes, this is a really big moment for us as a launch, as a release. We want to get people to know that we're here. We want to say, right, we are developing these top-end systems for measuring vision remotely. And if you are in any way as passionate about doing so really well and creating, you know, new sets of big data that we've never seen it before about eye health, then please get in touch.
Stephanie, I get the impression that I'm speaking to someone, despite 10 years of clinical experience and the early stages of an extraordinary journey. So thank you so much for joining me. Dr. Stephanie Campbell, founder of OKKO Health.
Thank you, Oli. Bye.